So we're going to talk about inflammation. Some common causes of inflammation would be physical change, such as a broken ankle, ischemia or infarction, so just lack of oxygen to that area, allergic reactions, or extreme heat or cold, or there could be a foreign body, such as a splinter. Just some things to remember about inflammation is that infection and inflammation are not the same thing. Infection can cause inflammation, but they aren't necessarily the same term, and they can't be used interchangeably. Inflammation is a protective mechanism and a warning sign, so it's not a disease within itself, it's just a warning sign for something else happening. And anything ending in itis indicates inflammation. So basically what will happen is that you will have an injury, such as jumping over the bushes at the Iron Bowl to get onto the field and you break an ankle.
So, upon breaking an ankle, the injured cells release bradykinins, which then stimulate pain receptors, and those call in mast cells and basophils. Mast cells and basophils then stimulate the release of histamines, and histamines affect capillaries in the injured area in two ways. It first causes increased capillary permeability, so that means there's a greater exchange of fluid and substances in the capillary, and fluid is leaving the capillary and is in the tissue around it, causing pain and edema as the skin stretches. It's also going to cause capillary vasodilation, which brings more blood to the site, and you see redness and warmth at the site of the injury. Lastly, by chemotaxis, which is just calling in of all the players in this game, we have monocytes and neutrophils that come in response to bacteria or foreign objects being in the injury site. And then monocytes and neutrophils are going to cause a blood clot to stop from bleeding, and they're also going to phagocytize the foreign materials to remove it from the site and form a scab to promote healing.
All right, so remember that we have acute and chronic inflammation. So acute inflammation would be when you jump Jordan Hare or the hedges at Jordan Hare and break your ankle. So it'll be more short-term effects, and it'll happen like right after the injury. So you have local and systemic effects for acute. So some local effects will be pain, edema, loss of function, redness and warmth, and then exudate. And remember that there's three types of exudate. There's serous, fibrinous, and purulent exudate. And then we have systemic effects, and this includes fatigue, malaise, pyrexia or a fever, anorexia, and a headache. And then we have chronic inflammation. And chronic inflammation is more long-term. There's less exudate, and there's less visible swelling. There's more swelling or inflammation going on inside the body. So like a certain organ, like hepatitis would be inflammation of the liver. And you would see more systemic effects with the liver being affected. So some things that go along with chronic inflammation would be more fibrous scar tissue, tissue destruction, and that's caused by the abundance of lymphocytes, macrophages, and fibroblasts. You'll again have more systemic effects, and then a granuloma will typically form, and that's like a bubble that will wall off the inflammation to protect the rest of the body.
And then potential complications of inflammation, we have skeletal muscle spasms, which is just a protective mechanism for pain, deep ulcers, which are brought on by prolonged inflammation, and then infection. So using the example of jumping over the bushes after the Iron Bowl, let's say you cut your foot open and some bacteria from the bushes got in. That would bring about infection. And treatment for inflammation, we have medications. So we have aspirin, which lowers your prostaglandins, which is the inflammation. And it's an antipyretic, which treats your fever. Tylenol does not deal with inflammation, but it is an antipyretic and an analgesic. And then we have ibuprofen, which does all three. It's an anti-inflammatory, antipyretic, and an analgesic. And corticosteroids deal with the positive and negative effects of the stress response. And then another treatment for inflammation is rice. So we have rest, ice, compression, and elevation.